Hi, hello everyone. Good evening, and I hope you're having an amazing Saturday. So, I'm sorry, I'm supposed to be here by 4 o'clock, but there's some network issues, so there's a delay of 5 minutes. So, today we're going to discuss an important topic. So, today we'll talk about skin cancers. So, last Thursday, like 4th of February, was a Cancer Awareness Day, and so we thought this would be a right topic to discuss, especially during this time. So basically, broadly, we can divide skin cancers into two varieties. One is a melanoma, and the second one is called non-melanoma skin cancers. So non-melanoma skin cancers basically have two primary varieties. One is basal cell carcinoma, and the second one is squamous cell carcinoma. So we simply say it as BCC and SCC. So BCC, SCC belong to non-melanoma skin cancers, and melanoma is the other variety of skin cancer. So basically, in our India, when it comes to our own country, we don't have so many skin cancers. Skin cancers is not very common in India. So when you calculate all the cancers that are happening in India, skin cancers come to less than 1%, but it's basically the most common cancer that happens in the Western world. So in US and European people, so skin cancer is the most common cancer over there. So what is exactly protecting us, protecting Indians from cancer is the eumelanin content that we have in our skin. So we have good amount of melanin when compared to the Western population, and so this eumelanin is actually protecting us from skin cancer. So we should be very thankful to our own color. Okay, but basically skin cancer can happen in anyone. So it can happen in people of any color. I'm just saying that it is most common in the other Western population, but it's not very common with us in India. Okay, so what's the most common thing that you will notice when so what happens where on the body it is most common? I'm going to tell you. So all the skin cancers are most common over your face and neck. Face and neck are the most common regions that are affected with skin cancers. And so why face and neck? And so any previous moles, if you have more than 50 moles, and if you see one of these moles is behaving a little differently, that it is itching or it's bleeding or it's forming an ulcer which is not healing quickly, which has been there for many days or many weeks but is not healing nicely, if you have any ulcer with this mole on this mole, and if your mole is suddenly growing very fastly, or there's a noticeable change in its color, noticeable change in its shape, size, and the borders have become irregular, so all these are signs that this mole is shifting into a skin cancer. So when you notice all this, you immediately see a board certified dermatologist, get it checked and get it treated quickly. Okay, so how are the skin cancers? Are they treatable? Is the most common question that I get to ask. So they're very much treatable. So initial diagnosis, like early diagnosis and good treatment, with early diagnosis and good treatment protocols, you can actually cure skin cancers. So among this, we are talking about three more common cancers like BCC, SCC, and melanoma. SCC is the most common non-melanoma skin cancer in India, and melanomas are not very common in India, but melanoma is a little dangerous one. It needs very quick diagnosis and very good treatment protocols to be done, because melanoma can spread to other parts of body very quickly, and it spreads to lymph nodes and all. So it has to be treated quickly. So there are various treatments that are available, both medical and surgical treatments are available, and so you can definitely get it diagnosed and get it treated. And so what are the most common causes? How do you get the skin cancer? So if you've been outside person always, there's so much of sun exposure, this UV exposure is there constantly since your childhood, that is, the exposure is accumulating as you go on. So when there is so much UV exposure, it could cause cancer, and there's a reason tanning beds are tanning beds are most used in the Western world. So these tanning beds are to be avoided, and tanning solutions sitting under the sun on the beaches should be avoided. And so we say skin cancers, especially melanoma, can be preventable. It is a preventable cancer. How do you prevent it? By applying sunscreen, because sun is the most common factor that causes skin cancers. So if you're applying sunscreen, any sunscreen which is above SPF 15 will be able to provide good protection for your skin. Okay, and the second thing is the most common thing that we discuss is an arsenic metal called arsenic. So how do arsenic, excessive consumption of arsenic or prolonged contamination with arsenic, prolonged consumption of arsenic in the form of contaminated water or foods can cause skin cancers. So how do you get this arsenic inside your body? So when we are using so much of pesticides, so these pesticides go into the earth and they release a form of inorganic arsenic, and this inorganic arsenic can mix up with water, and it mixes up with the groundwater, and that's how it gets contaminated. The groundwater gets contaminated with arsenic. So in few places in India, the groundwater is really contaminated with arsenic, and there are always studies that have been going on. They study groundwater, check it limits, and it should be under a limit arsenic, but it is, if the arsenic metal is above what it is supposed to be, the consuming contaminated water, and the arsenic is also present in poultry feeds. So any poultry, contaminated poultry can cause arsenic poisoning in adults, especially in human beings, and this arsenic can cause other forms of cancers also, but skin cancer is the commonest one when it comes to arsenic. And there's so how do you get another form is smoking. So if you're the one who is smoking, or if you have people around you when you're smoking, if you see so many moles growing on your body, it's your genetically you're prone to get those moles. But just don't worry, if your mole is acting little different, that it is itching, that is bleeding, or with a little trauma also it is bleeding, it is ulcerating, or it's growing very rapidly, margins are becoming irregular, it's become very very black than the surrounding normal moles. So these are the signs that you need to go to a dermatologist immediately, check it and get it treated. Otherwise, there's nothing to get panicked if you have moles on your body. So if there are more than 50 moles, is what they say, is more, if there are more than 50 moles also, just go to a doctor, go to a dermatologist, board certified dermatologist, and get them checked. So this is the basic things so broadly we have three types: BCC, SCC, melanoma. So SCC is the most common skin cancer. So any human papilloma virus, chronic human HPV infections can cause SCC, and radiotherapies that are given can cause a BCC type of cancer, and these cancers are most common on face and neck of the body. And so just don't worry about all this, because Indians are very much blessed. We are so much blessed because we have melanin content to protect us. So if you have dark skin, when we have dark skin, so we should be actually very happy that you're not a person to get the skin cancer, you're not the common one to get skin cancers. Okay, thank you so much for joining into this live session. This was a brief discussion. If you have any queries or any doubts, just WhatsApp, just messages in a private message. We'll be very happy to answer all these queries. Thank you.